Hello everybody, I'm Julie Bates and I work in North Cumbria in the North East, and I've been involved in this Autism in Schools project for, it's coming up 3 years now, as a piece of work that we did as part of an original Accelerator site work. And I've got a team of people with us, and we're going to talk about the learning from North Cumbria and North East, but also how it's now developed into a national rollout of the programme, which is what Phil mentioned when he was talking about the Autism in Schools project. So I'll just go to the top of my screen and say, Carla.
Hi, I'm Carla Scaife. I'm from Dionne Parent Carer Forum, but I'm also one of the North East and Cumbria co-chairs for the region, and I've been involved in the first 2 rounds of the Autism in Schools project. Thanks,
Carla. Dionne?
Hiya, I'm Dionne Hollis. I'm the project manager for the Autism in Schools project, and I clinically am an occupational therapist and first became involved with the Autism in Schools project by delivering the alternative CAMHS offer within the project.
Thank you. Jo?
Hello everyone, I apologise because my mute button's not playing the game. So I'm Jo Gilliland. I am the North Eastern Cumbria Steering Group member for the National Network of Parent Carer Forums. So I've been involved in the all of the behind the scenes stuff, not so much the delivery because our area didn't do it, but we'll get to that. So I've been involved since inception.
Okay, and Jill?
Hello. I've been involved since the very beginning of the project in phases 1 and 2 in encouraging, promoting and supporting schools to join in and increase the knowledge and understanding of those students who need some additional support in school settings.
Okay, Jill, do you want to just say what your background is?
I came from a local authority, and my manager was actually the Director of Children's Services and also the chair of phases 1 and 2 of the Accelerator site. He promoted it amongst his directors across the region and became very involved in the work that we were doing. He enabled me to join the team in the first 2 rounds, and then I've continued to work with the team for the last couple of years.
Thanks, Jill, that's great. Okay, so we'll get on. So this is a really exciting project. It's probably one of the best things that I've done in my career. It's been a really interesting bit of a roller coaster ride, but also been the impact and the way that it's supported co-production across our region has been absolutely magnificent. So if you want to move on to the next slide, Dionne.
Yep.
Okay, so why the Accelerator Schools project, which is now called the Autism in Schools project? Well, originally our area, North Cumbria in the North East, which is a big ICS now, it's got 13 local authorities, 8 CCGs, is a very, very big area, and we were a very high user of Tier 4 beds. And when we looked at the young people who were using our Tier 4 beds, what we found was a high number of them were autistic children, either had a diagnosis when they were in hospital or prior to coming into hospital. And we did a number of root cause analysis looking at those young people's journeys. And what we found was that all of those young people had been either excluded from school or were out of school for a period of time prior to coming into the inpatient setting. At the time, we just started working with our parent carer forums, and we had this kind of like idea that we were doing something wrong, that we needed to do something different. So we asked our parents what they thought needed to happen. What they said was there was too many missed opportunities. They said that small issues aren't addressed. They said that support needs don't always meet thresholds of services. and often had lots and lots of assessments happen and lots of discussions, lots of conversations, but there was no real action and nothing seemed to change. And they were left with their young person ending up in a crisis before they could actually do anything about it. So at the same time, just go back a slide, please. At the same time, we also, there was a lot of research that was happening about the number of, or seemed to be the increase in autism and the number of young people and adults who were ending up in our mental health wards. And what we were able to show was actually there was also some issues with our waiting times as well for a diagnosis. So what we found was that young people were often coming into hospital and getting a diagnosis when they were in hospital rather than prior to coming into hospital. Okay, next slide, please. So what is the Schools project about? It's got three main elements. And the first element is about building relationships and networks. And that includes building the relationships between school and our parent carer forums, but also the networks across our education, social care and health. So it's really important that all of those systems come together, and we're going to talk about that as we go through. The second element of it is about learning opportunities for schools and parent carers together. So it's about improving the workforce, thinking about actually what do they need for the future. As I say, this was a co-produced piece of work, and Joe will come on and talk to you a bit about that co-production as we go along. The third element was around raising awareness and making sure that the young people who were part of our project were able to learn about their autism as well, and hearing their voice about what's important for them within the school setting. So that's how the project actually started, looking at those three different elements. But essentially, what we were hoping to achieve was what we're calling here creating a capable environment. So creating an environment that not only supports the child, but also is a supportive environment, as in the actual environment itself. So the physical environment, the culture, and the way that children are supported to be in that school environment. So really thinking about all of those factors and how they contribute to ensuring that you've got a happy child within that school. Okay, so I'm going to hand over to Jo now.
With my sticky mute button. So obviously co-production is sort of embedded within the parent carer forums. It's our bread and butter. But it was really important that we were involved right from the very beginning in order to show that our families were actually the ones who were able to build their own offer and say what they wanted to see within these projects. And it was about getting all of that lived experience from families that we can bring back to the project and make it a stronger offer. And instead of us saying this is the offer, we were saying to people, help us build your offer. So right from the beginning, we were involved in how it's going to look, what are we going to do, how we can work together to strengthen the offer. What that led to was actually the parent carer forum as a region co-leading, having like a co-leadership model and a co-delivery model. So all of the training that's available would be co-delivered with them, you know, the professional and the parents, you know, really being there to say, I've been there, I've done it, you know, I understand, I have that empathy, whilst working with a professional to back it up. And it really helped the local parent carer forums to understand what's going on in your locality, what are families needing, what are they telling us, is there a common theme that runs right across the piece? Because obviously 13 local authority areas, it's a very, very big area, and there might be different areas of demand, but actually what we found was generally there was a theme running through. And it really helped the parent carer forums to strengthen the relationship, not only with their parent carer membership, but also with the schools in the area, because it's something that before schools were pretty reluctant to engage, but actually we were coming to them with an offer of support, and it really helped the schools sort of build that level of trust, and vice versa with the parents. And I think in its entirety, what it's helped us do is deliver across the system a better understanding of how everything fits together, how the DSR works, how CETRs work. We've presented, we've done workshops where we've met with families and we've talked through what these things mean. We really want this to be a process where things aren't done to families, it's done with. And that's really, really important, and that runs through the entire offer from the Autism in Schools project, and also to sort of enable schools to speak up and say what they feel they need, accessing the CAMHS offer, the enhanced CAMHS offer, and being able to communicate better with their families. So really about building bridges and bringing together that real, true co-productive feel, so that families feel like they own things that are happening rather than things are being done to them.
Thanks, Jo. So what I should have said at the start, because I didn't say, was how many schools were involved in the project. So I'll just touch on that before we move forward. So when we first did it, we did it across half of our patch, which had 5 local authority areas, and we asked them all to identify 2 mainstream schools and 1 special school. That was the first year. The second year, we continued to do that. We extended it, and it was mainstream secondary schools that we've taught about. In the second year, we actually included primary schools as well in that patch, and we extended it across our region. So we ended up with about 35 schools involved. And that included a small number of special schools, but mainly mainstream schools within that. Sorry about the noise in the background. Typical when you start talking. Okay, so as part of the work that we did, what we wanted to do was really think about actually how we're going to support the schools to increase their knowledge. So as well as asking the parents what they thought, we also asked the schools what they thought they needed to know. Now, the parents came up with a list of 5 things that they thought that the schools really needed to understand around their autistic young people. And then when we ran the sessions with the schools, they came up with exactly the same 5 topics. And this was really interesting, because you would have expected that there might have been some deviation between them, but it wasn't like that. So the 5 modules that we looked at was really about exploring and understanding what it's like for an autistic young person within the school setting. And that includes understanding the impact of sensory processing on the child, and also how it affected the whole day of that young person. The second element, which was based around positive behavioural support, but wasn't pure positive behavioural support, it was more around adapting, making reasonable adjustments, finding out what's important to the child and young person, and really, really adapting the school setting to be able to accommodate and support their needs. One of the things that we found was that other people wanted to know more about how to effectively communicate with young people, and also think about actually reducing some of the anxieties that the young people had within the school setting. So that was a module in itself. And then we talked about inclusive classrooms and how you actually support those reasonable adjustments within those classrooms. And then we had a session about person-centred planning as well. And the most important part of these modules was that it was about learning together. So we had schools send people along, so it might have been a teaching assistant, it could be we had a head of year, we had a SENCO, but we also had a parent carer forum representative at all of the modules, so that they could learn together. And I'm going to come on to tell you a little about the evaluation, but I'll just bring Jill in here if she wants to say anything else about that.
Yeah, I think the sessions were very interactive, and it was about what we can do rather than what we cannot do. And it was really about sharing some of the actions that schools and parents felt would benefit from their children or students. And the dialogue was really good. And obviously, as the sessions continued, that dialogue strengthened, and then they were helping each other to put things in place and became a support group for each other. So it was really developed and progressed, and they're still in touch with each other now.
Lovely. So each of the modules that we did, we made sure that there was an opportunity to evaluate them, and all of the modules were scored between very good and excellent. There was evidence of improving the confidence scores for the people who attended those sessions. There was an opportunity for us to develop school champions from the learning that they gained from those sessions as well. And we really wanted to make sure that the learning that the people who attended the sessions, that they were able to go and put it in practice and then come back at the next session and have a discussion about what they'd learned, what they'd done, share ideas about what had worked and what had made a difference. So there was a real kind of like learning cycle there to make sure that we were trying to change the culture within the school environment. So that's a bit about the modules. We'll come on to the CAMHS next.
So alongside the learning modules, there was an opportunity to have an alternative CAMHS offer. So there was 33 days of input to be delivered, and that was delivered by a Band 7 clinical specialist clinician. And I think the importance of that was that actually the clinicians that delivered the alternative CAMHS offer had a good understanding of autism and worked in the local area, so really could understand what each local area had in terms of what they were offering, what CAMHS offered within the local area, and were working, so were respected within the local area. And I think that was really important about building those relationships within schools. The initial school contact was working with the schools to identify their priorities and their areas of work within each school. So we did a scoping exercise, which basically helped us to work with the school to deliver an action plan and to provide the training that was meeting their needs that had been developed by them. I think what I found in particular was because each school had gone through the learning modules, it really helped us to be able to develop the learning that had already taken place within the modules and really support that to be consolidated within the school, and also to widen the impact within school by being able to spread it out a little bit further. And we did a number of things in school. So we did training. I did some work around supporting the school to think about the environment and how they could make reasonable adjustments. We looked at things like behaviour policy and looked at where adjustments could be made within their behaviour policy. For one school who had a provision, additionally resource provision, where they provided some non-curriculum activities, I worked with the school to develop some thoughts about how they could evidence the learning for Ofsted, because that was one of the things that they were really worried about. So really the support was very individualised to what the school needed, and it wasn't the same as what would already come from CAMHS. It was something completely different. But I think for me, the takeaway things from that are making sure that you have a clinician who really understands autism and really understands the local area, because what I did start to do a lot was to build those connections between the different services within the local areas, which was really important.
Yeah. Can I just add
yes,
a couple of things to that, Dionne?
Yes.
I mean, I think what was particularly important is that within the modular training, we were talking to the CAMHS people all the time. So the training that sort of rolled off that was bite-sized training, whole day CPDs, early evening training on a tea time. If they had although this wasn't to be for individual young people, where that same issue was coming up time and time again for the same school staff, then a training programme was developed for the school to enable the school to learn before another young person came in, so that trying to engage with the school to think forwardly about how they were going to manage certain situations, and also walking the floor, because I think we've heard a number of occasions that the environment is one that really can upset young people. Smells and colours and lighting, and these were simple things that schools could actually enable some changes around. Bells ringing at certain times, things like that. So I think the CAMHS alternative aspect was really important in that action planning with schools, and that trust and relationship that was built with Dionne and our other worker really helped in enabling that change to take place, in the trust that was developed.
And I think for me, there was a lot of new, it was about building relationships between schools and CAMHS, and very different relationships to what were already in place. And it was offering the school what they needed. So rather than going in, often within a CAMHS environment, you would go into a school and it would be linked to an individual student. And actually this felt very, very different. This wasn't linked to students. It was linked to being able to offer the school something that they needed and be able to work with them. And some schools did make quite immediate changes to the environment, or could make changes to the policies and protocols quite quickly. And some schools were really ready to do that. Other schools weren't at that stage of the journey.
Yeah.
But I think all of the schools got something out of it that was right for them. The walking about the school was really important, just to look at what happens in the school. I kind of would often firstly try to get there, say, to lunchtime, when I knew it was going to be really busy, when I could really sense when would be the busiest time, to get that feeling about what it's like, and also being able to give advice which would reduce the need for referrals and reduce inappropriate referrals. I think one of the things all of the schools said was, how do we get a referral accepted by CAMHS? And actually that was a little bit about talking about the pathways that were already in place, what school would need to look at before a referral was accepted. And I think that was really important, in having practitioners who were within their local area, who knew the processes and the systems. Steph in the South had a clinic model, and they had a dedicated resource for a CAMHS practitioner, and one of the schools reinstated that, and that led the schools to be more able to cope with young people. And what we did in terms of the training was be flexible. Schools are really busy places. CPD's often booked in quite a way in advance. So it was about being flexible with the school. So you could be in there at 7:30 in the morning and be in another school at 7:30 at night time. But you did have to be flexible to meet the needs of the school and go in with a really flexible approach. There was no way this project could have been done if we'd went in with that I work 9 to 5 attitude. It was about just working with the schools to find any space in the day that we could do some training. Yeah.
Thanks. We're going to have to move on, because we're using our time, unfortunately. And there's a question in the chat box. If we get the chance, we'll come back to it afterwards. I'm going to skip over the next 2 slides. So we did run a All About Me course, which was about helping young people understand their autism, and we did look at the voice of young people. We've got 2 films there which we can share. We can put in the chat box the links to those films, which were really important, and particularly the Take Time to Allow Time, which really gives you insight into the young people's journeys in school and what's important to them, which I would say that you should actually have a look at. Next slide, please. Okay, I think it's over to Carla. Or Jo?
It's me. So how we as Parent Carer Forums worked with the schools and the families. Firstly, forum representatives met with the school reps to explain the project and what each of our roles invited parents and the families in for coffee mornings and afternoon teas. We did write an action plan together, and we found that it was really important to have both the parents and the schools involved in deciding the action plans for their own schools. We sent surveys out to both parents and the professionals, and I know that in schools the staff that I worked with did theirs at CPD training evening, so it all got done at the same time. We sent them out by post to parents, and we also trialed doing an online survey for one of the schools as well. When we were working with the schools, we managed to set up mini forums within each of the schools that we were working with. We trialled using social media, and we supported joint training and PBS course for parents and the staff to attend. Next slide, please. So some examples of the impact on families. Parents fed back that there was positive changes from home to what they were taken away, what they'd learned. The school groups and the network has a value, and parents are learning and gaining in their confidence, and some of them school groups still continue to meet. Parents reported to us an improvement in their own mental health from having that peer support, and actually getting the right advice as well has a significant impact on parental resilience and well-being. We're learning more about what their children, parents were learning more about what their children were entitled to, and feeling more in control of that. And they said that they were feeling happier about raising worries and working together to find solutions. And I think that's a really important one, that it wasn't about complaining about the school, it was about working together to find the solutions together. We were told that the project had helped to break down barriers between schools and parents, and I really saw that genuinely myself from the schools that I was working with. Parents told us that they felt less isolated, and it helped the children too. Young people were seeing their value in their education and began working together. Next slide, please. So on the screen, I'll just skip through these quickly, but the impact in a mainstream school, one of the main ones from Rye Hill School reported, we have not excluded or isolated any child with SEND since February with this project, but there was 5 SEND children excluded in the same period last year, and I think that makes a real difference. Schools had requested and been involved in the CETR, and action plans were in place to keep children in schools. Next, please. And then if we look at the impact in a special school, the ASD pathway was to be delivered to staff. They were focusing on social stories and the importance of visuals. We set up networking links with other professionals, and the Parent Carer Forum made early contact with parents to ensure that they were getting all the support that they needed. Next, please.
Can you see that, Paula?
Yeah, sorry, I was just flicking screen. So feedback from the head of Rye Hill Academy, as we were talking about earlier, the academy has benefited from the training. It strengthened our good practice around supporting ASC students. They especially found the support provided by Stephanie Carr invaluable. The Autism in Mind All About Me sessions have been extremely well received by students, and it increases their level of self-acceptance. We've now developed a link with Helen, the Parent Carer Forum, which will improve how we work alongside our parents and support SEND children. And the training we attended was useful and has strengthened our policy around reasonable adjustments and also our knowledge of sensory processing. Can we skip to impact? Yeah. So the impact of the project for us, well, in the region, forums have gained new members. Our forums leaders had gained skills and got contacts that we never would have before. Schools have got a better understanding of the wider system and I know where to signpost families to. Schools are using person-centred tools such as one-page profiles and reviewing policies. Peer support and information for parent carers is improved, and as I was saying earlier, that the right information can sometimes be the difference between crisis and not. There's an interest in this approach from other areas, and we're thinking differently around and working together. We've had more care education and treatment reviews in the area, and listening to young people, we've developed a film together. Thank you.
So I think just quickly what next is that we are now currently rolling out projects across all 7 regions of England. There's 2 to 3 projects per region. And whilst we have asked that we maintain the 3 key elements of the project, there is real flexibility on the delivery. What we would want to do is to use the learning from the North Cumbria and North East, but for regions to be able to make that local so that it does get that locality feeling towards it. There's a community of practice to support regional teams, and there will be a national evaluation. And finally, this is just the geography and the spread out of projects currently across England. You will see that it does look like there's more than 15 projects, but some projects are one project covering 2 localities or 2 areas.
Okay, it's worth saying that each of the projects that we've got going across all of England have taken a slightly different. They're copying our kind of like key elements, but they're actually doing something slightly different, aren't they, Dionne?
Yeah, so they're all doing something slightly different in a slightly different way, but it'll be really interesting to see what the results are. And I think actually learning from the projects that are taking place now will be really important.
Okay, we've got a few questions. Where have I got a question? If you would like to put your hand up, because I haven't got time to go through all the questions, because we've literally got 4 minutes until we take our break. So if anybody's got any questions, please put your hand up. Yeah, Claire.
Hi, we're actually one of the areas. I'm based in Cornwall, and we're going to be working with Cornwall, the Isles of Scilly, and Bournemouth, Poole, and Christchurch. I think we're working together. We're still at the very early stages.
We want to come and see you. We want to come.
Yeah, you'd be welcome. I've got a view of the sea as I speak, just to make you all jealous. But yeah, so I was interested in the impact on attitudes towards CAMHS, because certainly in our area, sometimes because of the concerns around waiting lists, and quite often children with autism, CAMHS won't necessarily work with them, and that's the perception. And I wondered if it had an impact on the sort of both the parental attitudes towards CAMHS, but maybe school attitudes as well.
Definitely. When we first started, the first conversation that we had with the schools was that what they did was they've sent referrals off to CAMHS, and they often would sit on a waiting list, and then CAMHS would say, actually, they're not appropriate. And that was because actually the schools weren't aware of what was appropriate and what wasn't. And by building up to explain and think about the simple things that they could do that they didn't actually need a referral into CAMHS for, would make a bit of a difference. There was also some difference in the way that, CAMHS works. They've got a certain criteria that they work to, and sometimes it's like linking within the school environment and the home environment makes it really challenging. So some of the work that was done was able to be able to give the schools some pointers about what they could do in a different way, rather than having to go down that formal route.
Yeah,
I think
that sounds interesting. I think for us, I don't know that we've even got as far as thinking about which other organisations are involved. So it's been really helpful for me to hear about that CAMHS involvement today, and make sure that we are linking in either with our sort of specialist CAMHS service, but also we've got mental health teams in schools as well in our area. So I think all of those things will have to be important to be involved in the sort of planning, the next step of the planning stages. So that's helpful. Thank you.
Yeah, I think it's really important. It did definitely improve the relationships, because actually I felt like the schools were getting some advice and guidance, and were beginning to understand sort of CAMHS processes. And because, you know, myself and Steph were CAMHS practitioners at the time, we could take that back to the teams and provide that feedback into teams. So that was really helpful.
Can I just say it was about managing expectations, and it was about a hands-on approach rather than filling referrals in and having a hands-off approach. So it was about building the confidence of the staff who understood the children alongside the parents to try and do some of those early wins that just made such a difference. And some of that was about the environments that the children were in during the day. So it is about managing that expectation about you don't need a referral to do some of the work, but you do need the advice and the support and some of the training and some, you know, skill-based learning for staff.
Yeah, thank you. That's helpful. Thanks very much.
Thank you all. That was really fascinating and great to hear about all of the different impacts of the work you're doing, including the impact on exclusions, which is just fantastic to hear about. I can see there's a sort of practical question in the chat just before the session ends, which is around whether you're happy to share your slides and any links to videos and the strategies that you've mentioned with everyone on the call, and we can facilitate that if you're happy to do that.
Yes, definitely. We can share. Everything's been getting shared very widely across it, so we'd be more than happy to share. I am looking for the link, and Dionne will probably find it quicker than me, for the link for the films, and we will put them in. But if we don't get a chance to do them in the chat box, we'll send them to you, Saskia, and then you can share them widely.
Thank you. So the next workshop begins in just under 10 minutes, so there's a bit of time to go and get a cup of tea and have a break. But I have just seen there's one question there from Joanne that I was wondering if you would mind if you had sort of a 30-second answer around whether there's been work on the longevity of the project and whether there's a programme to keep new staff informed about it.
Yeah, so for North Cumbria and the North East, which Joanne's from, we just wrote out to all of our schools again to say this is our 3rd year. Are you happy to be involved in the project? Do you want to engage and continue on? We've had a lot of replies from the school, haven't we, Jill?
We have. We've had instant responses, yeah.
So we've got a really good number of schools who are still wanting to engage. We're actually linking up as well with the Autism Education Trust, and we want to move the programme on slightly further and link with our mental health in schools teams.
Yes.
So we've got a rolling programme of the modular training for our mental health in schools teams as well. And the aim is to make the schools to build resilience and understanding, so that, and then linking with the mental health in schools teams to actually make sure that the programme of work it's not just a case of doing this as a one-off piece of work, that it continues on. The national programme is running for this year. Ideally, it would have been better if it had been 2 years. It would have given it a lot more substance, and that is something. To be able to get that, what we need to do is show the benefits and the impact that it's making as it goes along from the first, like early starts of the impact. Like, I know already that the fact that people are talking about autism in schools and linking up health and social care and education together is starting to have some really good relationship building. That in itself is a good start, without even starting the project, you know, doing the project.
Brilliant, thank you. Great, so thank you all so much for your time. Hopefully you've all had an invite to the second workshop. If you haven't, do let me know, and I can send you a link. But yeah, thank you so much for your time and for a really fantastic presentation from Julie, Jo and Dionne. It's been fascinating, so thanks everyone, and yeah, look forward to seeing some of you in the next workshop at 3:50.
Thank you.
Bye. Thank you.
Bye.
Bye.